lined up right now, and it's Christine Miller from Before Crisis, and she's going to share lessons management in Africa.
So I'll help set the scene of us being in Africa. Now, like Charles, I have to be very precise in explaining that I am not representing the World Bank, but I can represent the Australasian Institute of Emergency Services. If I can get the clicker to work. Because I'm their national president. So you'll hear me mentioning my company Before Crisis rather than the World Bank, who's my current employer and who took me to Africa. Now, one thing I've learned, having worked with Aboriginal people for 8 years and other people of different cultures and different perspectives, is you can't assume that what you think's wonderful, OILL and lessons management, will be equally well received by the audience. And I recalled some of the work that I did in neurological psychology, where we were looking at evidence-based work that indicated that Southern and Central African folks are more interested in circles and arcs, whereas European folks are more interested in angles and straight lines. So I took that in my mind when I went to Africa and thought, okay, we all think it's a good idea, that's why we're here, but how will it be received in Africa? And the answer to that is, great idea, we want more of this, which is a relief to us all, I'm sure. But you might wonder why someone with a background in mountain rescue and policing would suddenly find themselves in the kingdom of eSwatini. I do wonder myself at times. And in health emergency management with that background. But nonetheless, the World Bank was willing to take a chance on me. And I do have some background in health emergency management, dating back quite a long way in the AIDS pandemic and hepatitis B programs. And way back when, yes, I really was a police officer. They even gave me a uniform at one stage. And in case you think AIDS is all over, it's still a big issue in Africa and a big issue in eSwatini. I sort of moved away from health emergency management for a while and worked on various things for the Australian government, the Commonwealth. And then all of a sudden we had this thing called SARS, the first SARS pandemic, which caused a lot of issues. And we eventually worked out what caused it, which was these Asian bats, as they're called, infecting civet cats, infecting humans, and hey presto, we had a pandemic. We're still not as well apprised of what's happened with respect to SARS-CoV-2. The DNA evidence is pretty clear. It's Asian bats with a dash of pangolin, but how they all came together, nobody knows with certainty. After the first SARS pandemic, the Australian government's COAG, as it was known then, brought together a group of people to write these plans. So we wrote this plan, which is called AMPI, the Australian Health Management Plan Pandemic Influenza, which was what is the Australian government going to do when we get the next influenza pandemic. And this one over here is Australian governments together working on the challenge of an pandemic influenza. And if you think, oh yes, it's just a case of flu. No, pandemic influenza is quite significantly different from seasonal influenza, which tends to impact on the very young, older folks and people with a compromised immune system. Pandemic influenza actually runs the other way. It attacks working age and otherwise apparently healthy people and causes their immune system to hyperreact. That was why there were so many deaths in the 1918-19 so-called Spanish flu. I also worked on stockpiling for the Australian government, New South Wales government, and more recently in eSwatini. And if you think I'm a bit like sort of Thai food Mary or whatever it is, some sort of bad news where health is concerned. I managed to get myself tangled up in a previous pandemic of 2019, the swine flu pandemic, when I was a business continuity manager for ACT Health. Currently, we're monitoring a couple of influenza-like viruses that are very concerning. The H7N3 in Victoria with the chickens, and there may be a H9 variant there, I just discovered earlier this morning, thanks to a colleague, and the H5N1 virus, which is impacting on penguins in Antarctica, having come down from South America. Now, why is this of any importance whatever to you? Pandemic influenza occurs in about a 100-year cycle. The last big one was 1918-19. Do the sums, we're overdue. So when COVID came, some of us who recognised the old plan and its subsequent iterations noticed that we had a new plan and a new cover and a few tweaks, and magically that was the COVID response plan. So we all hoped, those of us that were still in touch with one another, because obviously there are hundreds of people involved in writing these plans, we were hopeful that we'd done a very good job. And this fellow, Adam Cameron Scott, plays a very important role in all this. He was one of the writers of the plan and involved with Exercise Cumpston of 2006 and Sustain of 2008, which tested the 2008 plan, or the earlier version. Both of us lost our jobs, courtesy of COVID. So we were probably feeling a bit sorry for ourselves. And then he got a promotion. He lost his job at Sydney University, but got a promotion into Italy, poor thing. And he could no longer work for the World Bank. So they said, well, who else could help us? And since Italy has moved on to Harvard, poor thing, who else could help us? And he said, oh, maybe Chris. So I got dragged into this thing called HEPA, which is Health Emergency Preparedness and Response. It's a program of the World Bank, and you'll notice it's funded by some of your Australian tax dollars, along with the German and Japanese governments. Now, in World Bank terms, this is a very small program. Some of the grants are more than $120 million US, so this is like petty cash to them. But nonetheless, it's still an important program, and they're willing to invest resources in doing the best job they can. So I was sent off to Timor-Leste, which is the poorest country in Asia. It's about an hour's flight northwest of Darwin. And of course, many people here will recall the difficulties that they've had in Timor, especially when the Indonesians left. And eSwatini may be a mystery to you. So that's why I put a little map in there for you. See the arrow? It's surrounded by South Africa and shares a border with Mozambique. Now, as part of this work, I discovered that the World Health Organization had been conducting a whole lot of intra-action reviews, and I'd been doing some of those myself. Some clients and colleagues were interested in capturing the lessons and learning before they were forgotten at various milestones throughout the COVID experience. But what I was disappointed was these wonderful reports, and they're on the WHO extranet, they're publicly available. But then what? Where was the lessons management? Where were the implementation plans? Where were the action plans? Where was the cycling back into their COVID response plans? Noticeably absent. So I probably did a bit of a Bert and grizzle to them about this. So my first in-country mission, and I had to invest about $4,000 in vaccinations and medical appointments to get safely in and out of the country. It's a 2-week mission. The first week was spent trying to understand emergency management in eSwatini, who their friends and partners were, how they all work together, because a lot of these low and middle income countries, they rely very much on donor countries. So you have to understand the context before you move too far along the path with them. And also to understand what sort of exercise experience that they had had before we suddenly arrived and wanted to fund a series of exercises for them. So it turned out that they had had a rather legendary exercise where they managed to burn somebody's house down because the fire truck couldn't get up the hill to sort it out. And they were still sort of smarting about it because this had become something of public mention in the local media. And so when they planned an exercise, people said, oh no, whose house are they going to burn down this time? They did have a bit of a pushback. And they're telling me they want to run a full-scale exercise when they're also telling me about some of the previous learning. And I think, are you ready? Now, because they run an international airport, they have to do an annual ICAO exercise. The International Civil Aviation Organisation requires all internationally rated airports to run such a thing. And it's field exercise, it's not entirely tabletop. And even those had had some problems with crash gates and codes for gates and ambulances accessibility and so on. But nonetheless, they were still eager to go. So we had a second week of our mission in country, and you'll see how eager they were. This is dinner time. We practically had to switch the lights out to get them to go to dinner. They were very motivated because they really wanted a tabletop exercise in November of 22 and a full-scale exercise in the field in November of 23. And they knew they were really going to have to put their heads down to make that happen. So, always the innovator, I decided, well, we'll try a bit of OIL, but we'll maybe try it a little bit differently. We'll try and capture some of the learnings that they've had from some of their previous exercises with variable results. But we'll also try to use it to look forward, because they had money from the World Bank to plan these exercises and other activities. And what we used OIL also to structure their report backs, because there were multiple groups and some people wanted to sort of have a foot in more than one group. And also we asked them to sort of dream large, you know, what would you really like to do? Where do you think we should take this opportunity, this grant funding, and make the best difference in health emergency management in eSwatini? And from the very start, I was talking to them about activities and implementation plans and so on. And some of them said, well, you know, how does all this work? So I gave them the cat example. And then someone pointed out to me that cats in Eswatini, it's a poor country. I also took AIDR's products to Eswatini, and they're very grateful, and they very much look forward, as do I, to the subsequent editions. But it gave them a good template for them to work from. So moving on from the cat to something that had real world significance for them is cholera. It's one of their major disease risks, as it would be in this country. You'll notice often when we have floods, public health talks about what they call boil water alerts, because sometimes the water treatment systems and the sewage systems have been overwhelmed. It's for that very reason. Now, under the World Health Organization's International Health Regulations of 2005, one case of cholera is considered an outbreak. But in our thinking, we tend to think of it more as a near miss. These two cases were what we call imported cases. They were not local people. Had they been local cases, they would have been testing wells and doing a whole lot of environmental health work. What we discovered, fortunately, the two cases were the two cases. Unfortunately, both of these people died. They were so dehydrated by the time they got treatment, they were really beyond help, sadly. But nonetheless, the colleagues in eSwatini learned a lot. They realised that their plans worked. They did have plans, but nonetheless, they felt they could do better. So they reviewed their plans and they conducted a tabletop exercise on cholera in July of 23, and they used cholera as their November 23 full-scale field exercise. They then updated their plans and procedures and shared their insights. So it was a couple of health posts that were impacted by these two cases. And they were smart enough to isolate these people very quickly and do smart things to protect from spread. So we wanted to make sure that other frontline health posts understood what they did and would hopefully implement the same wisdom were they confronted with similar symptoms in their visitors. So here we go to the full-scale exercise. At one point, we had 300 people involved. It involved defence, police. I was wondering if anyone was left in the health sector because there were so many people here. We're at Pigs Peak, which is about 90 minutes drive out of Mbabane, which is the capital city of Eswatini. These people here are very significant. That is Dr. Malanga, who runs EPR, which is Emergency Preparedness and Response in Eswatini. This fellow is Dr. Jundu, who was the lead exercise facilitator. This fellow was the lead evaluator. And I'll come back to that because that's very relevant for lessons. They sent me into the field. Oh yes, I've got a jacket there over my chair. Sent me into the field as an evaluator at 2 sites. So I went to what's called the formal border at Matsomo. And this fellow, who's doing an Oscar-winning performance of a person with cholera, is actually one of their sort of top-of-the-range rapid response ambulance crews. He's a fully trained paramedic. So he made a very convincing cholera case, so much so that when he was transported to hospital, one of the other evaluators had to stop them from putting an IV drip into him and start rehydrating him because he was obviously so sick. Little too convincing. Another thing that was a little unusual, here's the ambulance. It took them 9 minutes to arrive to a border location, which even I thought was rather swift. Then 10 minutes to get all their PPE on and eventually look at the patient. But you'll notice this lady here is the port health official who is rostered to be at the port, at the border, no PPE at all. And she was in quite close contact with the patient. She didn't touch him, but some of the others were even closer. Anyway, these people were not told that there was an exercise on. What they were told was Ministry of Health officials would be coming to their site that week and there would be some unusual activity. So they were completely in the dark as to what the hell was going on. So here she is looking actually a bit shocked when we tell her, no, that was an exercise. He really wasn't sick. So we did a hot wash debrief before we left and quickly discovered that the normal response time for the ambulance, and I'm not surprised the locals were yelling impossible, is 90 minutes on the best day. The ambulance would normally have to come from Mbabane on a fairly mountainous road to get to the border with South Africa. So clearly there were some learnings there. The good news is even before I arrived and reinforced the learning about get those ambulances close to the border, please, they're actually doing that. So from the incident debrief and from the tabletop debrief, they got funding. And this is an ambulance that was in the back of that building on the graph. They're still having trouble with the water supply, but this is a donor-funded project to get those ambulances closer to the border. We've talked a lot about lessons learned and evidence of lessons learned. Well, I thought you'd like to see one. So obviously with 300 people involved, role plays, observers, evaluators, teams in the crisis centre, you'd end up with a large amount of, must be way back. Go back. Large amount of oil material, as I called it, oil on steroids. And just to make it even more exciting for them, the following day, so the sequence was 2 days of preparation, Monday and Tuesday, 2 days in the field, Wednesday and Thursday. Friday morning, they had to report to no less a person than the Deputy Secretary, Department of Health, in charge of EPR. They did it. And they did it in no small part thanks to this wonderful woman here, Marjorie. Marjorie pulled together the work of the evaluators and some of the other people. We used WhatsApp and we sent our reports, our photos, our videos. They're making a documentary about this. They interviewed me not looking very camera ready, so God only knows. This was my fixer, Lingali. Without her, I would have been totally lost because the closing ceremony was 2 hours and conducted in Swazi. And some people say I can barely manage English. So I was a bit lost, but nonetheless, I smiled through it. This person is the country representative for the WHO, Dr. Susan Tembo, and she's briefing the donor partners about how the exercise proceeded over the previous 2 days and some of the early learnings. It was very impressive how quickly. You heard yesterday from Kimberly how fast they got feedback and learnings from the exercise Aurora last week. Well, these guys did it manually. I often joke, get out of the way of an eSwatini, just let them get on with it and they'll make it happen. Poor Marjorie had recklessly retired, so they brought her out of retirement to help them pull all this together. Now, it's not all beer and skittles. My friends at the WHO and I have a few differing views at times, not the least of which is this. Now, if you could see it, you would see that the final thing in their report, in their exercise cycle for a full-scale functional exercise, is the mission report about the exercise. To which I replied, okay, lovely. Are we back where we were with the extranet and intranet COVID reports? Then what? So I've raised this because one of my roles as a World Bank technical advisor is to make sure that the HEPA funds are value for money. Well, I'm sorry, folks, unless you're doing something with those reports, I'm struggling to see the value for money. But it's not as though I'm not coming to them without a solution. So there are many observations. And you might wonder, well, I was there to talk to health, but I also spent quite a bit of time talking to the bigger emergency management schema, of which health emergencies is but one. And here is the CEO of NDMA, which is the National Disaster Management Agency. And further, because eSwatini had just done this wonderfully brilliant full-scale exercise, they were being invited to other African countries as observers and taking some of these ideas with them. So who knows, the Africans might be coming to tell us how to do it better another time. And this is another key person. This is Yanda. Without her, the logistics, including the catering and IT, would have been very problematic. So she's a key person. And we don't have time for questions because it's lunch.
Nice try, Chris. A fantastic presentation and another perspective on the, there we go, on oil use. You know, we often think about it just in the Australasian context, And I think, you know, potentially now we're looking at another jurisdiction that we can look into for insights and lessons especially in the pandemic thing. We're often in Africa, a lot of that stuff starts. So yeah, really interesting. We've got a couple of questions, but we might have time for one anyway. Any reflections of differences between WHO methodologies and Australian exercise and lessons methodologies?
They probably do it quicker than us.
They do it quicker than us.
Yes.
Hmm.
Because when it was first put to me that they wanted to do these exercises, remember, I first became involved with them in April of 22, and they were telling me they wanted to have a pretty big tabletop by November of 22, and we're starting from zero. And I'm going, okay, we might be able to do that. And then they said, oh, but we want to have a full-scale field exercise in November of 23. You want to have what, when? So my usual advice would be 6 months to 2 years, you might have a chance of pulling it off. But as I say, don't get in the way of these young and energetic eSwatis. They want to do it, they'll make it happen.
Yeah, and the second one was a reflection on, it's such a great story. When's the documentary coming out?
I'm actually asking them about that because we had a lot of photos, a lot of video, a lot of Chris looking very poorly at being interviewed. So I'll be interested to see what the final product is. They did show us a video that they'd done in Kenya, so we had a bit of an idea at the front of the exercise on those 2 days of preparation, what we could expect. Oh, and the World Bank and WHO funded the video, so we've got every right to ask to see it.